Every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those exact words. And for some of them, the cause was never their age at all. It was a bottle sitting quietly on the bathroom shelf. The very bottle they were promised was perfectly safe. I'm Dr. Henry Morgan. After more than 15 years in practice, I have watched this same painful picture unfold more times than I could ever count. Someone who was sharp their entire life slowly starts losing the thread. Names slip away. Appointments vanish. The drive home they have made 1,000 times suddenly feels unfamiliar. And everyone standing around them simply calls it getting old. But it wasn't old age. It was a medication. One that almost nobody ever thinks to question, because a doctor prescribed it and a pharmacy filled it, and that alone made it feel trustworthy. Here is what the newer research keeps showing us again and again. One ordinary everyday class of drug can pull your memory and your ability to learn down hard inside a single year. And most of the people taking it have absolutely no idea that it is happening to them. Today, I am going to walk you through the 9 medications most closely tied to rapid memory loss. We will count it down, starting from the ones that get quietly overlooked, all the way to the one I personally consider the most destructive of them all. Watch closely for number 3. It is handed out to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of your brain right now, without giving you a single warning sign. Before we begin, tell me in the comments how old you are and which medications you take every single day. I read them, and the age of this audience genuinely shapes what I cover next. Let's start at number 9, and please don't let the low spot on the list fool you, because this one is sitting in almost every medicine cabinet in America. Number 9 is diphenhydramine. You know it by its drugstore name, Benadryl. It is the little pink pill people reach for to fall asleep, to calm an allergy, or to take the edge off a stubborn cold. It costs just a few dollars, it sits out on an open shelf, and most people assume that because nobody needs a prescription for it, it must be completely gentle. But inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That is a long word for a very simple idea. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain uses to lay down a new memory and to stay alert throughout the day. As we age, the brain naturally makes less of it, and it leans harder on every last bit it has left. So a drug that blocks it lands far heavier on a 70-year-old brain than it ever would on a 30-year-old one. The part that takes the hit is the hippocampus, that small seahorse-shaped structure where your new memories are first formed before they get filed away for safekeeping. In my own practice, I have watched patients take a nightly antihistamine for years and slowly lose their edge, never once connecting that growing fog to the little pink pill sitting by the bed. The research connects it plainly. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with the people who stayed off them entirely. That is more than half again the normal risk, from something most of us treat like candy. Here is what to do. Read the label on anything you take to help you sleep, and anything marked PM, nighttime, or allergy relief, because those products are very often just Benadryl wearing a different name. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, that do not cross into the brain the way Benadryl does, and they are far safer for the long haul. Never stop a medication on your own. Bring it to your doctor first. But please stop assuming that over-the-counter automatically means safe for your memory. That is number 9. Number 8 is one your stomach loves, but your brain quietly pays the price for. Number 8 is the proton pump inhibitors. The big names here are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These shut down acid production in the stomach, and they get handed out for heartburn, for reflux, and for that burning feeling after meals. People stay on them for years, sometimes for decades, because the moment they stop, the symptoms come roaring right back. So it genuinely feels like the drug is the only thing holding the line. But here's the part almost nobody ever hears at the pharmacy counter. Your stomach actually needs acid to pull certain nutrients out of your food, and chief among them is vitamin B12, which protects the delicate wiring of your nerves and your brain. Turn that acid down far enough, for long enough, and your B12 quietly drops. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those, and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's, when the real cause is a nutrient your medication has been blocking all along. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than the people who did not take them at all. And the trouble runs even deeper than the nutrients, because PPIs have also been shown to raise levels of amyloid beta in the brain, the sticky protein that builds up in Alzheimer's disease. So here's the move. If you take a PPI every single day, that is the conversation to have with your doctor. Many people can taper down onto a gentler class called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to affect your thinking. Chewing deglycyrrhizinated licorice, a natural compound that coats and calms the stomach lining, can ease symptoms with no cost to the brain at all. The goal is the lowest dose for the shortest time, not a pill you take forever out of pure habit. Number 7 is prescribed for a problem most people would honestly rather not talk about. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as ditropan. It is given to seniors who deal with a sudden, urgent need to get to the bathroom, the kind of overactive bladder that can reshape an entire day. The relief it brings is real, and the embarrassment it spares people is just as real. But oxybutynin works by blocking acetylcholine, the very same memory chemical that Benadryl blocks, and this one slips across into the brain very easily and parks itself right where your memories are made. That makes it one of the more dangerous ones on this entire list for an older adult, especially when it is taken month after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a single year. Their risk of dementia was 49% higher, getting close to 1 in 2. And here is what troubles me the most. Almost none of them were ever warned. They were told a pill would calm the bladder. Nobody ever mentioned that it might be dimming the mind at the very same time. The fog gets blamed entirely on age. People describe forgetting appointments, losing their keys 10 times a day, dropping the thread of a simple conversation. And everyone around them just nods and says, "Well, you're getting older." It is rarely traced back to the prescription until real ground has already been lost. If you take oxybutynin and you have noticed your memory slipping, please take that seriously, because you do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they provide the very same control with far less risk to thinking. Bring it up at your next visit. Number 6 might just be the most surprising one here, because it is one of the most prescribed drugs on the entire earth. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medicines in the whole world, especially after age 60. And they do an important job, lowering cholesterol and reducing the risk of heart attacks and strokes. Statins belong in a lot of people's lives, and this is not a case against them. But what follows is the half of the story that usually gets left out. Cholesterol does far more than just affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the insulation wrapped around every nerve so that signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it actually needs. The statins that cause the most trouble are the ones that cross most easily into brain tissue. In 2023, a study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. And the higher the dose, the steeper the decline. Some patients describe frightening blanks, a familiar name suddenly gone, a conversation they had just finished completely erased, a route they had driven for 20 years now feeling strangely unfamiliar. The important thing to understand is that not every statin affects the brain in the same way. Pravastatin and rosuvastatin do not cross into brain tissue as readily, and they are generally considered safer choices when it comes to preserving cognitive function. So if you have been on a statin for years and you are noticing fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly stop a medication that may be protecting your heart. Get the plan right with professional guidance, never on your own. Quick pause. If this is helping you connect the dots, take 1 second and tap that like button. It genuinely helps this information reach more seniors who need to hear it. And while you are down there, tell me how many prescriptions you are taking right now. I read every single comment. All right, back to the countdown. Number 5. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan, diazepam, sold as Valium, alprazolam, sold as Xanax. These are among the most commonly prescribed drugs in America for anxiety and sleep problems. They work by boosting GABA, the brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like a genuine rescue. The panic eases, the racing thoughts slow right down, and sleep finally comes. But over time, the picture begins to change. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting medications, such as diazepam, appeared to be even more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain itself. What these medications do is create a slow chemical sedation of the entire brain. Learning becomes slower and mental flexibility decreases. Many people describe a sense of emotional flatness, as if they are moving through a fog and no longer feel entirely like themselves. The cruelest part is the exit. If a benzodiazepine is stopped abruptly, the anxiety and insomnia often return with even greater intensity, accompanied by an agitation that can become genuinely dangerous. That makes the medication feel completely indispensable at precisely the moment it may be causing the greatest harm. So here is the rule, and it truly matters. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly, because doing so can be life-threatening. Work closely with your doctor to taper the medication gradually, over weeks or even months. There are gentler alternatives out there. Buspirone, for example, can help with anxiety without causing sedation or mental clouding. There are also specialized forms of talk therapy designed for insomnia and anxiety that can restore calm without any of the cognitive cost. Now, let's move on to number 4. Number 4 is a single medication prescribed for 3 different problems, and it carries one of the heaviest hidden burdens on this entire list. Number 4 is amitriptyline, sold as Elavil. It is an older antidepressant that is still widely prescribed today for nerve pain, for sleep difficulties, and even for migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that can do absolutely everything. But beneath the surface, it is one of the most powerful anticholinergic drugs still in common use anywhere. That means it strongly blocks acetylcholine, the very chemical your neurons rely on to communicate with one another and to store new memories. It blocks acetylcholine so aggressively that, with long-term use, memory problems stop being a rare side effect and begin to resemble an expected outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic drugs, such as amitriptyline, over a 10-year period, had a 54% greater risk of developing dementia. And almost none of them were ever told that the medication could do that. They were given it for sleep or for pain, then gradually noticed words disappearing, memory becoming thinner, and concentration weakening, and they simply assumed it was all just part of getting older. It does not even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without any obvious warning signs until the loss becomes truly significant. If you or someone you love takes amitriptyline, that is a conversation worth having very soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without the same anticholinergic burden. For sleep, melatonin, or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may serve as alternatives. And for mood disorders, newer antidepressants such as sertraline or escitalopram are generally considered much safer for the long-term health of the brain. Number 3 is the one I told you to watch for, because it is prescribed to millions of people for something that sounds completely harmless. Number 3 is paroxetine, sold as Paxil. It is one of the most widely prescribed members of a family of antidepressants known as SSRIs, used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many of the older psychiatric medications. But here is the detail that is so rarely discussed. Paroxetine is the one SSRI with strong anticholinergic activity. That single characteristic sets it apart from related medications such as sertraline and escitalopram, because it affects the exact same acetylcholine system that every other medication on this list has been disrupting. In 2021, a large review published in Frontiers in Psychiatry examined older adults taking different SSRIs and found that paroxetine users demonstrated measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those using other antidepressants. There is a painful irony buried in that finding. The medication is prescribed to help stabilize the mind, yet over time it may erode the very clarity it was intended to protect. The solution here is straightforward. In older adults, paroxetine is generally a medication worth avoiding when alternatives are available. The American Geriatric Society placed it on the Beers list, which is a formal catalog of medications considered potentially inappropriate for seniors. And paroxetine appears there for precisely these reasons. If you take it, speak with your doctor about the possibility of switching to a safer SSRI, such as sertraline or escitalopram, which are gentler and do not carry the same cognitive concerns. Supporting healthy levels of B vitamins, especially B12 and B6, may also help support mood alongside these changes. Number 2 is prescribed so quietly that many of the people taking it do not even realize what type of medication it truly is. Number 2 is antipsychotic medication, and this one concerns me deeply because many individuals taking these drugs never knowingly agreed to take an antipsychotic at all. The names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These medications were originally developed and approved for serious psychiatric conditions, such as schizophrenia and bipolar disorder. Today, however, they are often prescribed off-label to older adults for sleep problems, for mild restlessness, or for the agitation associated with dementia itself. Powerful medications designed for severe psychiatric illness are now frequently used in homes and nursing facilities for seniors who are simply confused, restless, or difficult for busy caregivers to manage. The cost can be substantial. In 2022, a study published in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a single year, even when they had no history of dementia before the treatment began. These medications can also increase the risk of stroke, of sudden cardiac death, and of the profound sedation that contributes to falls and hospitalizations. They work by suppressing dopamine, a chemical involved not only in mood regulation, but also in focus, in planning, and in memory. Reduce dopamine enough, and the brain becomes slower and far less responsive. That is why some individuals taking these medications can appear dull, emotionally flat, or almost absent, while their families grieve the gradual disappearance of someone who is still physically present right in front of them. If you or a loved one is taking one of these medications, the first step is to ask the prescribing physician a direct question. Why was this medication started in the first place? And is it truly necessary, or is it being used primarily for convenience? Many behavioral symptoms can often be improved without medication at all, through consistent daily routines, through reduced noise and overstimulation, through the treatment of hidden pain, and through better management of sleep and lighting. When medication is genuinely required, the lowest effective dose for the shortest possible duration helps reduce the harm. Far too often, families are never informed about what these medications can do to the brain. They watch a decline they believe is simply aging, when the true cause may be entirely chemical. Now we arrive at number 1. Number 1 is not a single medication at all, and it may be the biggest hidden driver behind every single story I have discussed today. Number 1 is anticholinergic polypharmacy. It is the danger almost nobody talks about, and it may be one of the leading causes of medication-induced memory loss in older adults. You are probably expecting one final villain, one single worst pill, but the reality is far more subtle. The greatest danger often comes from the slow accumulation of multiple anticholinergic medications taken together, while nobody ever calculates the total burden. Polypharmacy simply means taking many medications at the same time. Anticholinergic burden refers to the combined effect of all of those medications blocking the same memory-related chemical simultaneously. Imagine a very common scenario. A senior takes Benadryl every night for sleep, oxybutynin every day for bladder control, and amitriptyline for nerve pain. Individually, each medication may produce only a small and barely noticeable effect. Together, however, those effects compound, and the burden on the brain rises rapidly. In 2022, a study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years. That is more than double the risk, and the overwhelming majority had no idea they were taking anticholinergic medications at all. No one had ever explained it to them. When acetylcholine is blocked from several directions at the very same time, the brain does not simply slow down. Neurons can begin to weaken from underuse, connections may shrink, and the brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease during cognitive testing. But here is the hopeful part, and it is the very reason I made this video. Medication-induced cognitive decline is often reversible when it is identified early. Reduce the burden, and many people regain their clarity, their energy, and their memory within weeks or months. The brain is far more resilient than most people ever realize, but only when the source of the harm is finally removed. The solution does not require a miracle. It simply requires a careful medication review. Sit down with your doctor or your pharmacist and review every prescription medication, every over-the-counter product, and every supplement that you take. Add up the total anticholinergic burden. Simple scoring tools are available to help identify that risk. Once the problematic medications are identified, unnecessary drugs can be reduced or discontinued under proper medical supervision. Safer alternatives can be introduced, and the brain can be given a real opportunity to recover. This may be the single most preventable threat to the aging brain on this entire list, and that is exactly why it holds the #1 position. Now, I want to hear from you. Of these 9 medications, which ones are currently sitting in your medicine cabinet right now? Have you noticed brain fog or increasing forgetfulness after starting a new medication? Tell me in the comments below, and tell me that you will ask for a medication review this week. Your answer might be the very thing that helps the next person who reads it. And before you go, there is one more place your body quietly hides its warnings. Your medicine cabinet is one place, but your hands are another. Your fingernails can reveal warning signs involving your kidneys, your blood, and even your nervous system, years before any other symptoms ever appear. Most people never learn what to look for. That is the topic of the next video. I will show you the 4 nail signs worth checking tonight. I'm Dr. Henry Morgan. Stay sharp, and I will see you there.